You use breast thermography in your practice. What is that, and how is it different from what women traditionally get as a mammography?
Thermography, the concept behind thermography is rather than detecting abnormal calcifications, which is technically what mammograms do, it's a thermal image. And they do thermography actually for detection and surveillance of other cancers. And actually the argument is that thermography can detect cancers much earlier because cancer cells are very hypermetabolic and they're producing a lot of new cells, a lot of blood vessels, so they put off more thermal energy, which will show up as a different color on a thermographic picture. And so it's still not something I can recommend as an alternative to mammography simply because that's still not standard of care. But patients have very real concerns about the radiation exposure with mammograms and the cancers, the early cancers that mammograms may not detect. So I have some patients, and it's their choice to either do mammograms, thermograms only, or a combination of both.
And so what entails a thermogram? What does a patient go through versus mammography? We've heard how uncomfortable mammograms are. What are the differences?
Well, you don't the breast isn't actually exposed to any trauma, for lack of a better word. It's basically a thermal image. So the patient basically stands and you take a picture. And you have to obviously let them rest because just the whole idea that they can exercise and that's going to produce energy. So there's a specific protocol by which you use to get them prepared for but then it's a picture. So nothing's put in between metal anything and there's no radiation exposure. It's just a thermal image.
Can that at some point be a better alternative than a mammogram, or is that not going to be accepted, do you think?
It depends on who you ask, and because I'd like to keep my medical license, I probably won't answer that. But the fact that I mention it to my patients and I let them know about it, obviously I do put credibility into thermography. And at the very least, patients, I believe, need to do it at least in conjunction with mammography.